Hi students, for today's class we're going to address 8 concepts to keep in mind in thinking through how best to communicate information to people that they need to keep themselves healthy. This information is taken nearly verbatim from your Brown and Closser text that I know many of you don't have access to where you are now, and I thought it was really crucial enough in terms of conveying some important considerations in health communication, so I wanted to make sure that it remained part of the content of the course. So the first consideration to keep in mind is what's called the fallacy of empty vessels. This is the belief that people in other societies, we can refer to those as target populations, do not already have any health knowledge or beliefs. This is incorrect. That's what makes it a fallacy. And those pre-existing beliefs influence how new ideas are accepted. Understanding that people receive health messages within the context of their own beliefs is essential to achieve effective communication between health promoters and the public. The second is that people's behavior is almost always understandable and logical within their own social and cultural context, and it is further shaped by their particular conditions of social class and access to resources. So the challenge here is to understand the other group's point of view when developing health communication programs, rather than expecting your audience to share your own point of view. The third consideration, questions of compliance, and that itself is a problematic concept, are linked to issues of power. And the people who give health messages have more power generally than the people who receive them. Healthcare providers sometimes perceive patient noncompliance as a problem of disobedience, and they expect the receivers of health messages to comply like obedient and powerless children. This attitude does not fit well with a model of partnership and respect. Fourth, many people's responses to epidemics across the world will be religious in nature. And these religious responses to disease are not exotic or primitive, they are human and need to be considered within the context of framing your health messaging. Fifth, beyond religion, the meaning people ascribe to illness in a particular setting is reflective of larger social, political, economic, or moral concerns. When faced with a new and frightening disease, people make sense of it in what they see as moral terms. In a world of gross economic inequalities, there are significant moral elements reflected in the illness experience of individuals. Sixth, stigma is a very important factor to consider in health communication programs. We can define stigma as the negative social attribution placed on people because a disability or an illness makes them different or considered not normal according to local social rules. Stigma is often the result of fear, and it leads to long-lasting suffering. Seventh, the illness experience may include social and psychological dimensions, like stigma, that cannot be cured with medicine, and that in some cases may be worse and last much longer than the illness itself. Attention to the human aspects of the illness experience is not a strength of biomedicine. In fact, many see this as a major failing of biomedicine that is the reason that more and more people in the United States use alternative healthcare systems. And finally, eighth, trust is important. Widespread fear in social groups, as we see in the case of a pandemic, can result not simply in scapegoating and discrimination against individuals, but also in violence and forced displacement of large groups of people. Social tensions between groups can lead to a lack of trust and a lack of cooperation in times of emergency. Fear of new diseases or fear of government entities can hamper the reporting of disease outbreaks. We know that combating new emerging infectious diseases, which can spread rapidly around the world because of airline travel, requires mutual trust and international cooperation. Clear and effective health communication can help with that.